Hi, good morning. My name is Youjeong Kim, and I am giving the private practice perspective during the pandemic. I'm a small business owner of an S Corp, and my practice is called Golden Gate Spine, and I'm in solo private practice in San Francisco. I saw on the survey that there are approximately 30 to 40% of you who are in private practice. I don't know how many of you are in solo private practice. That's somewhat of a rare breed these days. I employ 5 full-time staff members, a PA, an office manager, 2 MAs, and a biller. And I see approximately 40 to 50 patient appointments per week, 4 to 6 elective surgery cases that are mostly outpatient. And I dedicate 1 day per week to an admin day. And I take no ER or trauma call. As far as the timeline goes for the pandemic, on March 16th in San Francisco, shelter in place was ordered until April 7th. And so all non-urgent medical appointments and surgeries were placed on hold. I believe I did a couple cases for patients with foot drop and deltoid weakness. But aside from that, my staff and I were all at home working to reschedule all patient appointments and surgeries. We explored options for telemedicine on Zoom, and approximately 1 week later, we offered our first telemedicine visit. It was very inefficient at 1 appointment per hour. We really thought that we would be in this for about 1 month, and we were so wrong. The shelter in place was extended 2 times, and it wasn't just until recently that we were back in the office, and even that we are back in the office part-time and only doing a subset of elective surgeries with some new COVID-19 protocols in place. We needed to adapt the practice to working from home and relied on a few different apps to all virtually connect. And we started to do these daily morning huddles with everyone, all hands on deck, just to outline everyone's task list for the day. The voicemail had to be checked remotely, and we had one designated person who would go to the office to check the mail and the fax machine and water the plants. Then there were some complicating personal factors. The schools were also closed, and my kids were at home, and I share this home office with my 2 kids. So this is my desk, and they sit kind of right behind me. So if I were doing any kind of patient work or Zoom meeting, you would see this guy in the background. So he had to be relocated to the living room. And there he goes there. Our Wi-Fi at home, I'm sure you all experienced, was also limited. We had to upgrade so that 4 people could be on Zoom at the same time. This is my husband and my 2 kids on their school Zoom. And then we had a dentist appointment that we needed but was canceled. Had to deal with a snaggle tooth. So that was complicating things. I think we could all probably finish this sentence. I love spending more time with my family during the pandemic, but ... And then a little bit into March, I had some concerning symptoms, somewhat of a panic of, oh no, is this it? There was limited testing facilities even at that time in San Francisco. I tested negative, and life goes on. And I had been looking for new office space for a few months, and complicated things further with the purchase of this real estate property, starting construction, all during the middle of the pandemic and the craziness. And as a small business owner and 5 full-time employees, I also needed to look into applying for the PPP loan. So these are all complicating things just while we're trying to figure out how to survive.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.